The Supreme Court is jumping into the fight over transgender issues, agreeing to hear an appeal from the Biden administration seeking to block state bans on gender-altering procedures for kids. The justice's action comes as Republican-led states have enacted a variety of restrictions on health care for transgender people, school sports participation, bathroom usage, and drag shows. The case before the High Court involves a law in Tennessee that restricts puberty blockers and hormone therapy for transgender minors.
Let's welcome author Jacqueline Toboroff, as well as board-certified OBGYN Dr. Greg Marchand. Doctor, can you answer this question? What is a woman? Because it seems to be an issue here. And if we could identify exactly what these genders are, maybe we would be getting somewhere. But this argument keeps going on politically. But you're a doctor. Tell me there are two genders.
There are indeed two different genders. There are only two genders, although there are many, many different mental disorders. I'm a board-certified OBGYN. I can tell you what a woman is. It's someone that has XX chromosomes and someone that's capable of reproducing. So that's going to be what a woman is. This is a very interesting case in front of the Supreme Court. As you said, there's over 25 different states now that have enacted laws against gender-affirming, or rather so-called gender-affirming surgeries and other so-called gender-affirming therapies, such as hormonal blockers, which don't seem to be entirely reversible. So I think all our eyes are on the Supreme Court here and what the ruling is going to be.
Jacqueline, why is the left so hyped up about changing the genders of young children?
Well, I think the encroachment of the federal government never stops under Democrats. First, we had the unaffordable Obamacare, and now Biden seemingly wants to stop procreation and tamp down on population control.
And doctor, let me ask you the psychological impact. Whenever I hear of somebody who is a minor, I don't think there should be a transgender minor, because I think you should have to be of a certain age to do anything associated with changing your gender, however that's defined. But psychologically, don't kids go through a difficult time, some of them, in their preteen and teen years that get worked out over time psychologically, regardless of what their gender happens to be?
Oh, you couldn't be more correct. I think we'd all remember being a child, being an adolescent, going through different phases, trying different things out, trying to see where we fit in. We know that the children's minds have a tremendous capacity to change. That's why we don't lock up children for life if they commit crimes. Children are malleable, and that's exactly why this is so evil. We have people coming along here offering children who are entering puberty, offering them a way to put that on hold. Can you imagine anything more cruel than a scared adolescent telling them that the changes of puberty, growing fat in places you don't want, your voice changing, new smells, and telling you have a way to put this on hold? So yes, this is definitely a very wrong thing that's going on. And here in this country, in the U.S., there are girls as young as 13 that it's been documented that we've allowed these girls to have their breasts cut off by surgeons, like literally their breasts cut off, double mastectomy only for the so-called diagnosis of gender-affirming surgery. So what you've got here is people, I'm going to use the word groomers, that are behind this, encouraging these children to go this direction so that they can be stopped from going through puberty and be forever malleable, essentially being forever patients, requiring injections on a weekly or monthly basis just to keep their cells, and their cells know which gender they are. Every cell has chromosomes, to keep those cells from doing their job of keeping them healthy.
And doctor, quick follow-up on that, because, you hear the stories from so many that, were allowed to change their gender, have these life-altering procedures done as a minor, that then become adults and say, I wish I hadn't been convinced into doing this. Tell us quickly, if you can, just about 30 seconds or so, what these people are going through after the fact when they realize as an adult, you know what, I shouldn't have done this, but now it may be too late to go back to the individual they were before.
horrible, and I feel so bad for these people. If you look on social media, the detransitioners, they're suppressed a lot by the mainstream media, but they're such an important facet of this argument. These are children that were talked into these hormones and these surgeries when they were young. Some of them had their breasts cut off. Some of them had hysterectomies. Now some of them can never have children at all. A lot of them can never breastfeed. All this was taken from them before they had a chance to reach the age where they could make the decisions. When they were too young to drive, too young to get a tattoo, and this was taken from them. This is really horrible. Every adult in this country should be outraged and stand up against this.
Yeah, so much more to talk about here. Jacqueline Toboroff, thank you so much. We will definitely have you back. We've got a lot to talk about as this issue goes forward. Dr. Marchand, thank you as well, sir.
Thank you.
Thank you.
We will be back with more on National Desk.